Welcome to the FootHealthFacts podcast, powered by the American College of Foot and Ankle Surgeons. I'm your host and a fellow of the college, Dr. Matthew Dairman. To help kick things off, I'm joined by Dr. Ashleigh Medda, a foot and ankle surgeon out of Winston-Salem, North Carolina, and a fellow of the American College of Foot and Ankle Surgeons. Ashleigh, thanks for helping me introduce our new show.
Yes, excited to do it.
Yeah, so let's start with a basic but important one. What is the American College of Foot and Ankle Surgeons?
So it's a medical association that represents podiatric surgeons who specialize in taking care of all surgical and medical conditions of the foot, the ankle, and the lower extremity.
So you and I are both fellows of the college. What does that actually mean?
Well, it means that a podiatric surgeon has achieved a recognized level of professional achievement.
For patients who might not know what to look for in a specialist, what does being a fellow signal to them?
It means that they can feel confident that they are receiving care from a trusted, highly skilled, and exceptionally trained specialist who's committed to delivering the best possible outcomes for their foot and ankle health.
You know, I always find it interesting because I suffer from imposter syndrome a bit, where I feel like I just don't know enough or I'm not in the position that I should be in. But then I remind myself that I passed the boards. I did all this stuff. I am a fellow of the college. And it's kind of one of those things that even as a professional of 20 something years in practice, that, that's quite an accomplishment. I think in a high bar that our profession sets for our colleagues to match. So it's kind of neat to be part of that club.
It really is. I agree with you. I suffer from imposter syndrome too. And it's just, I don't know, amazing that all the work that we go into to try to help the patients with their foot and ankle health.
Yeah, it's kind of neat that we get that opportunity. So let's talk about this podcast. Why did we decide this was the right time and the right format?
Yeah, I think that we recognize that a lot of patients struggle to access clear and trustworthy information about foot and ankle health. And a podcast really allows us to connect to a wider audience in a convenient and just kind of like what we're doing here, that this conversational format. Unlike traditional brochures or medical websites, podcasts like this one really meet people where they are. So you could be listening to this on the go in your car, at the gym, or anywhere. And so by using expert voices and real patient stories, we can do a lot to help break down any barriers to foot and ankle health.
Yeah, I think it's important for everybody out there to understand that we are people. Patients especially put doctors on a pedestal. And in my experience, podiatric foot and ankle surgeons in general are just happy people. We try to be personable, authentic, caring, knowledgeable. And I think within this podcast, we'll be able to demonstrate that a little bit better, make it a little bit easier for patients maybe to come on in, maybe referring physicians listening to this to say, oh yeah, I like that person. I think I want to send my patient there. They really know what they're doing, and I think that's hopefully where we're gonna really hit our mark.
I agree. I think we really just want to aim to educate and empower and just engage our communities, making foot and ankle health just more accessible and relevant too.
Absolutely. So going forward, each episode will focus on a specific topic, conditions, injuries, or deformities we treat every day as foot and ankle surgeons. We'll cover things like heel pain, sports injuries, bunions, hammer toes, pediatric concerns, you name it, we'll cover it. And if we haven't named it, send it in. We'll do it for you. Each episode will feature a different colleague sharing expert insights in a way that's easy to follow and hopefully easy to listen to. And if you're someone who's dealing with foot or ankle issues or just want to stay a step ahead, you're in the right place. So Ashleigh, thanks again for being here and for helping us set the stage for the FootHealthFacts podcast. I know we'll be hearing from you again in future episodes with your surgical hat on.
Thank you so much for having me.
You've been listening to the FootHealthFacts podcast. For more information about the American College of Foot and Ankle Surgeons or any foot and ankle concern, head over to FootHealthFacts.org. On behalf of the college, I'm Dr. Matthew Dairman. Thanks for joining us today. Together, we'll keep everyone moving forward, one step and one topic at a time.